What's up, everybody? My name is Mia, for those of you who don't know me, and for my clinical and community-based research methods course, we were tasked with making a COVID advocacy project. So here are 5 facts about COVID that you may not know.
According to the Pandemic Mitigations Collaborative COVID-19 Forensic Model, we are currently in the 10th wave of the COVID-19 pandemic with an estimated 900,000, 1.3 million new infections daily. On average, a person has been infected 3.6 times, with 1 in 45 people within the US being infectious as of January 13th, 2025.
Per the CDC, approximately 1 in 5 adults ages 18 plus have a health condition that might be related to their previous COVID-19 illness, such as neurologic and mental health conditions, kidney failure, musculoskeletal conditions, cardiovascular conditions, respiratory conditions, and blood clots and vascular issues.
The U.S. Bureau of Labor Statistics has discovered that the labor force participation rate has dropped by 0.8%, meaning 2.15 million people left the workforce when the pandemic hit. In addition, the National Center for Health Statistics notes a large drop in life expectancy, drastically decreasing from the start of the pandemic at an average age of 79 to about 76.5 in 2021.
COVID-19 is not the same as a cold or flu. In 2023, Bowe and others conducted a study and discovered that there's an excess risk of health outcomes 2 years after hospitalization for acute COVID-19. This includes outcomes such as cough, Alzheimer's disease, loss of smell, irritable bowel syndrome, and cholangitis, which is an inflammation of the bile duct. Another study by Xi and others in 2024 found that among patients hospitalized with COVID or flu, tracking 94 health outcomes, it was found that 64 were substantially worse if patients had COVID.
Steps to being precautionary are as follows. Rule number 1, if you are symptomatic with any illness, stay at home. If you have COVID-19 symptoms, test for 5 or more days once you've been exposed or are symptomatic. Once you achieve 2 negative rapid tests after 48 hours, that are 48 hours apart, you can end isolation. Rule number 2, mask up. Avoid low quality masks like face shields, cloth masks, and surgical masks. Obtain higher quality masks like N95s and N99s and like the headband version of the K95s. Rule number 3, clean the air through adequate ventilation and filtration to ensure that it meets the American Society of Heating, Refrigerating, and Air Conditioning Engineers standards.